we are here to help on that journey and walk. Got a great team. Give us a call. And there can be a little bit of confusion about what exactly are they doing there. And so that's why we've had these open houses and the ribbon cutting, and we want folks to call or even just come in. Heck, I'll walk you through the place and lay eyes to it and get a better idea, because what we're doing is it is a little bit different than what traditional medicine, although we still, again, offer that. It's looking at things from the long game perspective. How can we get back to feeling better? And it's not typically one prescription, two prescription thing, but it's an education and it's a process. So that's why we have a bunch of educators there, essentially, medical professionals that not only work through different modalities and treatments to get you feeling better, but educate you so we can make better choices to get feeling better, get that quality of life going.
Speaking of feeling better, especially during the summer, we're lots of times off for different foods. This is a great time of year for watermelon, cantaloupe, sweet corn, beans, a lot of great garden products. And so we're going to kind of mix that in a little bit with maybe talking a little bit about diabetes too.
Right. So, an example, yesterday I had a great lady coming in and wanting to join the family practice monthly membership, and where she'll sit with me and long extended visits to go over options for her blood sugar management. And she's on a couple prescription medications and just not moving the needle on her average blood sugar, the A1C. So she's getting a little bit frustrated. And so we're going to take that journey together and talking about, just because you're avoiding certain things like potatoes, starches, things like that, she felt like she was doing a pretty good job just sticking with fruit. And again, not all fruit is created equal. And yet, granted, I'd rather have you be taking a watermelon than instead of a candy bar. But berries, for instance, strawberries, blueberries, those are going to be the class of fruit that you're going to want to aim more towards. Has lower glycemic index, so when you eat it, your sugar's not spiking, which is a big thing for blood sugar control. So that's one thing we talked about. The other thing we talk about is how often gluten, and some folks even dairy. As much as I enjoy dairy doesn't enjoy me. So dairy can be one of those things for folks that are battling blood sugar problems to look at, because there's some mimicry that occurs that dairy, when we eat that, it can inflame the pancreas as well. So it gets the body thinking, oh my goodness, not only am I going to attack this dairy, but I'm going to attack the pancreas, which produces the insulin, causes inflammation, and our body's inflamed. So those are the different types of approaches we talk about. Then there's some natural supplements out there, products. N-acetylcysteine is a great thing to talk to a provider about, with more of a natural way to lower blood sugar. Another one is berberine. If you look that up, do a PubMed search, and that's the really out there right now is a strong natural supplement. So the other big thing is, just because you have a diagnosis, I don't like to put diagnosis necessarily on things, because it's like then it's stuck with me, and so I was always taught in medical school, once you have diabetes, you have it forever. Even if you get your blood sugar below 5.7 or 6.5 for the A1C, it's there. And that's not true. I will have a friendly discussion to not validate that perception that is taught in medical school and everywhere. But Paul Merrick's an MD that was huge into early treatment of COVID, and he's a brilliant guy. He used to use in the ICU high dose vitamin C as well for management of his patients. Did really well with that, but he had the D word, the elevated blood sugars, and his A1C was around 8, and he did a lot of the nutritional approaches to this, and by golly, his A1C got below 5.7, and it's staying there. He was on multiple medications, and now he's back to no medications, and just managing it with lifestyle and nutrition. And so it is possible. Anything's possible. I always like to say, don't put limits on yourself. So we shoot for the stars, and I think when we're vibrating in that, when we've got that right attitude, that makes a lot of things better. It makes it a lot easier to get your own things that maybe aren't up to snuff from a wellness perspective better when you're excited about things and saying. I had another guy that came in, speaking of hope, the other day that and he was about ready to start hyperbaric therapy. He had a lymphoma, and he's like, I believe that this is going to work. We are going to shrink this. So that's the kind of attitude that is beneficial for all involved.
Visiting with Dr. Bradley Meyer of Okoboji Wellness Clinic, and the reason we bring up like the different fruits and some supplements and some different type of care that is explored, because traditional medicine, we have, and certainly you do traditional medicine, but we're generally accustomed to walking in, getting the prescription, and walking out. Mm-hmm. But with the direct provider care, the integrative family care, you're able to actually spend time. You talk about peeling the layers of the onion back a lot. You're able to spend time with people and say, whoa, maybe you should try this down the nutrition trail.
Right. So it's all about where you're at in your journey. And I want to give you informed consent and options. And a lot of times in the traditional world, I myself, when I was, doing more corporate medicine, I didn't spend enough time. We were given maybe 1 or 2 hours of nutrition training in medical school. And so therefore I reached for what I was taught in medical school, which was pharmaceuticals, metformin, pioglitazone. Those are some common medications for blood sugar management. And not to say that might not be the approach you choose, because sometimes too we have to bridge when the sugars get really, really high, trying to bring it down with eating right. If your A1C is over 10, it's really a combination approach. So you may need to be on insulin for a short term. You may need to be on some oral anti-hypoglycemics, and in the process of doing some of these other things. But in the journey, if you are interested in getting off of some of these medications, it is a possibility for many people. But that's the choice. So if you're like, well, I really don't want to change my lifestyle and how I eat, and it's a busy day, and my life's crazy anyway, I'm going to take the pill, I'll prescribe that for you, and that's fine, because that's your choice. But I just want you to know that there's another way that you can take, and we're there to educate you about that other way and work with you if you choose to pursue that path to get you on less medication to manage blood sugar, for instance.
And we have heard the stories about people, especially elderly people, it seems like when they're transitioning in life a little bit, that they might change a provider or change circumstances, and some of the medications get pulled away, and they somehow a little light switch comes on and they get to feeling better. Now, listen, this is not my area, but I've just heard stories like this, and
totally true. Polypharmacy is a real thing. Anytime you get over 5 to 8 prescription medications, and I was in that same boat. I would add more and more medications traditionally, because a lot of times you'd have a downstream side effect if you were on one medicine that was treating one thing that was helping one thing, that maybe it was not helping something else, and then I would recommend another medication to treat that something else. Eventually you get to soup of all these medications that on these interactions that sometimes can put you in this state of stupor or fog, and so sometimes that deprescribing and starting back over with in a responsible manner, you talk to your physician about it, about, hey, how can I work backwards and get off of less of these medications in a response, because sometimes you have to wean off of them, and you can't just just stop them because your body has grown used to having them there. So there's a way to do it, but yeah, absolutely encourage you to give us a call if you want to learn more about what we do. I've got the membership, direct primary care, which again, sometimes people, I say DPC there, like that acronym throws them. Essentially, I'm doing family practice again, but it's a monthly membership to come in and see me with longer appointment times and unlimited visits. So if you want to learn more, just stop in, call the clinic. The gals are happy to educate and give you more information, or set up a welcome visit, which is complimentary, a 15-minute visit with me to say, hey, is this right for me? Coming on board with some primary care, family practice care management at Okoboji Wellness Clinic.
Very good. And they can find you?
Yeah, at 712-339-6024. Again, we're in Spirit Lake, just off Highway 71, just north of Fix Ace Hardware.
Very good. Dr. Meyer, thanks as always.
Thanks, Dave.
Dr. Bradley Meyer with us today. Okoboji Wellness Clinic, easily found, OkobojiWellnessClinic.com. Give them a call today, see if it's right for you.